Okay, so Renzo, I'll just pass this back to you. Maybe I'll just keep this up for a bit if you
Sure,
want to.
yeah. Actually, that was what I was thinking. Before I show my slides, let's first look at the word cloud that was created through this Mentimeter. And some of my observations are one, of course, there are some, slight variations in the phrases, but overall, there's no single term or two that is quite dominant. Oftentimes when we hold this kind of Menti surveys, there's like a favorite term or a favorite problem that many, people in the audience actually, say or write. But this is quite a dispersed listing of words. Although climate, somehow I can see it at least thrice, and something related to biodiversity and habitats. But overall, I think what this tells me is that, one, the young people who are in this room, or Zoom rather, have a very broad sense of and understanding of the challenges that we are now confronting. Number two, I can see that it's not only the the problems that relate to, for instance, the environment that are listed here, but someone, and actually the first word that came up is ignorance, and there's uncertainty, and there's economic failure. And so this room also is not just looking at the symptoms of the problems. There's climate change, there's degradation of habitats, there's poverty. But some of you were also thinking of what are the root causes of these problems. Ignorance and perhaps, illiteracy, or really this lack of even empathy towards these issues. Inaction, for instance. What are these bottlenecks that prevent us from solving these problems, even if you listen to the politicians, you listen to the scientists, you listen to the leaders. Many of our leaders actually already know what the problems are. But as you've said, there's inaction, there's uncertainty, and there's, well, it's interesting. There's even one word, politicians are what scares you about the future. I would love to hear more later, maybe during the discussion with Tanshri Jamila. So, I think, Sarah, we're done with this word cloud. And, maybe later on, I would like to hear other folks, maybe to elaborate what you wrote there. Maybe Jamila and my teammates, Ollie, Sarah, also have some initial thoughts as to what scares the young people of today. But let me share with you some slides for the next couple of minutes. And one, I'll add to that shared understanding that we already have regarding planetary health challenges. But also, I hope that by the end of this short presentation, I'll also turn your, fear and, feeling scared into optimism and hope, that there is hope. And that's why I said here, planetary health perhaps is the new compass that we need for our post-COVID future. So first and foremost, I want to acknowledge that we are having this discussion in the middle of a pandemic, and it's far from over yet. The Delta variant is going around. Vaccine rollouts are still not as fast as we want them to be, and there are new variants arising. Maybe I'm not sure if Lambda already reached Malaysia. It already is here in the Philippines. I'm actually speaking from the Philippines right now. And this should not be surprising. COVID-19 should have not been surprising to us because, many years ago, we've already been told that the planet's health is essential to prevent infectious disease, especially the emergence of new ones, like COVID-19 and other coronaviruses. And so we've really not listened to what the scientists were saying before, that we need to address the root causes of infectious disease emergence. And now we have COVID-19. As you know, the main hypothesis or theory is that, the virus jumped from an animal to a human being. And if we don't address the drivers of, for instance, human and animal interaction, then we can expect more COVID-19s to show up at our doorstep in the future. But this pandemic is not the only challenge that we have. And as you can see in this diagram, I will not belabor you with the details, but as you can see, our actions change the planet, which impact our health in return. So it's actually quite cyclical. We do something on the planet, and then the planet changes, and then it creates new health problems or diseases that affect us in return. And as you can see in this diagram, our consumption patterns, because what are these actions that shape the planet? Our consumption patterns, our demographic shifts like urbanization, migration, mobility, the youth bulge or increasing population, but also the advancements in technology. I'm pretty sure all of us are looking forward to the next model of the iPhone or the Android, but we don't usually think about the ecological implications of technological advancement. And all of these changes impact the environment, as I've said, and in return impact health. So on the right, you will see the different disease groups that will be affected by planetary change. Under nutrition, infectious diseases, as I've said, non-communicable diseases like cancers and diabetes and obesity. Displacement, people are getting displaced because of, for instance, extreme weather events, disasters. And of course, there's growing evidence that even our mental health is already being shaped by the changes that we see in the environment. And this is the reality. So maybe you've heard already of the term great acceleration. Everything is going up. Our CO2 emissions, carbon emissions, the level of acidity of the oceans. And that means our fish, our corals, our different marine creatures will not be able to survive. And that will impact, our global fisheries. Energy use, especially from fossil fuels, the rate of deforestation, the use of water resources, and also fertilizer, artificial fertilizer, which we use in agriculture. So everything is going up. And so we can expect, if you remember the previous diagram, we can expect that the health problems related to these environmental changes will also go up. And that is very concerning for us. I'm a physician by training. Dr. Jamila is also a physician. And so we really care about the human patients, but now we know that the diseases of our patients are coming from the changes in the environment. So damaging the planet damages human health in return, as I've said. And these are just some numbers. According to the World Health Organization, 250,000 deaths annually will be created by climate change in the future. And this is an underestimate. It's hard to actually estimate how many diseases or deaths will happen in the future. So these are definitely limited by the research methods that we have. I've already mentioned undernutrition or, biodiversity loss, for example. We know that a rich biodiversity is important because that's, we get our medicines and food from the forest or from the marine ecosystems. So these are just some of the problems that will affect our health in the long run. So I already implied on this a while ago. As a physician in the 21st century, in the day and age of COVID and climate change and all other problems, I now see myself having two patients. The human patient, okay, as you can see, this young child wearing a mask, trying to protect herself from the coronavirus, but also the planetary patient, Mother Earth. And you can imagine Mother Earth also wearing a mask herself, not to protect herself from COVID, but to protect herself from the human activities, the actions that I mentioned to you a while ago that are afflicting harm and danger to her own well-being. So two patients, people and planet, this should be our mindset. We now have two patients, even if you're not doctors. And so that's the reason why planetary health, this new powerful concept, was born. You might be familiar with public health. You might have heard about it over and over again in the news because of COVID. But public health will not be sufficient and adequate to solve the environmental problems. So we need a new paradigm that brings together the health of people and the health of the planet. And that is what planetary health is. This is the definition from a 2015 report that was published in the medical journal, The Lancet. And so when we say planetary health, health of people, health of planet, we should actually be concerned with all of these and more, in this things that are in this diagram. Of course, the living creatures, and not just human beings, but also animals and plants and the microbes that reside in our ecosystems, but also the abiotic or the non-living aspects of the ecosystem, soil, water, and air. But also, as you can see here, the human systems, the social systems, our politics, our industries, the economy, the way we urbanize, the way we migrate and move, our agricultural systems, all of these should also be part of our planetary health diagnosis and treatment in the arena of solutions as well. And because we are dealing with so many different things, we need multiple disciplines and sectors. So as you can see here, planetary health is really the merger between the health sciences and the natural and the physical sciences. And actually what's not in this diagram is the social sciences. So we should create a new Venn diagram that actually adds a third circle, which includes the social sciences, the anthropology, sociology, psychology, economics, political science, etc. And actually, I can see that some of you have already introduced yourselves in the chat box. I also would like you to tell us which disciplines or professions are you coming from, because we want to have an appreciation of the diversity of the young people who are in this room. So tell us if there are any other doctors here, or engineers or designers, computer scientists, because we want to find ways to harness your different talents, all in the name of planetary health. And this is an important reminder. As I've said, Dr. Jamila and I are physicians, but we realized that actually the health of our patients is not created inside the hospital or the clinic. It's not generated by the doctors and the nurses. It's not given to you by the pill or the X-ray machine. Our health is created outside of the medical care system, as you can see in this pie chart, in the social factors, in the environmental factors, in the behavioral factors. And this is what planetary health is about. We want to get out of the hospital and the clinic, and we want to go and tackle the root causes of the health problems that confront our populations, but also confront our planet as well. So it's not just anymore just the people. Again, it's also about the health of the planet. And speaking of the health of the planet, this is one way to diagnose the health of our planet. There is a framework called the Planetary Boundaries Framework. Okay? And this was developed by the Stockholm Resilience Center in Sweden. And basically it says that there are 9 planetary boundaries. And unfortunately, as you can see here, 2 out of 9 have already been violated or breached. They're the ones in red. Biosphere integrity, for instance, because over the past century, we've seen the fastest rate of extinction of creatures great and small. And we know that biodiversity is so important, again, for the health of people and planet. The other boundary that has already been violated is the natural biogeochemical flows of P and N. Can anyone tell me in the chat box what's P and N? These are elements from the periodic table. What is P and what is N? And I can see a geologist, I can see some energy analysts here. So I'm pretty sure you know what P and N is. Phosphorus and nitrogen, correct. So these are 2 elements that are so essential for the growth of plants. And what we've done is we've injected so much artificial phosphorus and nitrogen into the soil which then led to this disruption in the biogeochemical flow of these two elements. So 2 out of 9 already violated, and 2 out of 9 more in danger, the ones in yellow. Climate change, and we know that in the Paris Agreement, we were told that we cannot go beyond a global average temperature increase of more than 1.5 degrees Celsius. Okay, and we want to achieve that before 2030. And also land system change, because we've turned every natural, many natural ecosystems into cities, into human habitations, even golf courses and malls. And so we need to really think about how we're using our land resources in order to prevent this yellow to becoming red. But it's not enough that we prevent the violation of the planetary boundaries. We want to make sure that we are able to both safeguard the planet, but at the same time provide for the well-being of the people inhabiting the planet. And so I want to introduce another concept called the donut economy. And the donut economy, as you can see, it looks like a donut because it has a hole inside. And basically what Kate Rayworth, who is the originator of this concept, says, our economy, our future economy, cannot go beyond the ecological ceiling or the planetary boundaries, but we cannot also have shortfalls or deficits in terms of the social foundation. So there is this, limited space, and that is the donut where our economy should be operating in. Nothing more and nothing less. And it really tells us the importance of achieving balance between the health of people and the health of the planet. So donut economy, it's not just a safe space, but it should also be a just space for humanity. And I always say that this book, Donut Economics, should be required reading for all Planetary Health citizens. So if you don't have a copy yet, please order it as soon as you can. Okay. Oops. So now I just have a quick game here. Who's closest to becoming a donut? So this is an interesting study by the University of Leeds in the United Kingdom. They used a wide range of data sets, and they tried to illustrate or create these donuts, okay, to show which of the countries in the world, around 150 countries have been assessed, which country is closest to becoming a donut. The first country that you have is USA. As you can see, okay, very, very little red inside in the inner part of the donut. So that means they've already achieved almost all of the social foundations. But as you can see in the outer part of the donut, you will see a lot of reds. And that means they've exceeded a lot of the planetary boundaries: CO2, biodiversity, phosphorus and nitrogen, etc. Let's go now to your country, Malaysia. And you will see there's still some reds inside, but there are also a lot of reds outside. And so we have problems when it comes to meeting the social foundation, the needs of people, but also we've already exceeded some of the planetary boundaries, not to the same extent as the United States, but almost getting there. Because as we know, Malaysia is a continuously growing, market economy, middle income country. You know what was the answer of this study? The country that is closest to becoming like a donut? It's a country 3 hours away by flight from Manila and Kuala Lumpur. And that is our fellow ASEAN country, Vietnam. As you can see in that donut, they also have very little red in the inner part of the donut. And they've only violated one boundary, and only to a very minimal extent, and that is CO2 emissions. So now the question should be, how can we be like Vietnam? Okay? Of course, Vietnam has its own issues and has its own, political and economic character. But based on this diagram, the donut, they seem to have healthy people and also healthy planetary boundaries. So that is an interesting question to ask. So now, in the next couple of slides, I will just be showing to you some of these planetary health challenges. I already mentioned climate change. And climate change is not just an environmental issue. It's not just an issue about dehydrated polar bears, although of course we want our polar bears to be fluffy and looking healthy. But ultimately, climate change is about the health of people. And right now, people are already affected by the health impacts of climate change. I'll not go into the details of this diagram, but as you can see, there's so many pathways that link climate change to human health. And there's no single disease group that will be immune to climate change, from infectious diseases to undernutrition to mental health. And unfortunately, we live in a region that is a climate and health hotspot, as you can see in this map. So this is the map of Southeast Asia where we all belong to. And interestingly, in this map, the redder the country is, the more vulnerable the country is to climate change and its health effects. And unfortunately, it's my beloved Philippines that is the reddest of them all. But it doesn't say that the other countries are not any more vulnerable. All of us are vulnerable to certain degrees. And so climate action will really be good for health. That should be the message that we should be saying. If we change our urban systems, the way we produce energy, the way that the design of our transport systems, the way we consume food, we will all reduce our carbon emissions and we will reap all the health benefits, both to physical, but also to mental health. Another problem that the Sunway Centre for Planetary Health would like to tackle in the next several years is the possibility of pandemics. And we want to make sure we prevent the next pandemic. And unfortunately, Southeast Asia is not just the hotspot for climate change. We're also the hotspot for infectious disease outbreaks. So here is a map of all the important infectious disease outbreaks that have happened before COVID, and they all came from Southeast Asia. And so Southeast Asia is not immune to pandemics, and it can also be the birthplace for the next big pandemic. So it's very important that we address the drivers of pandemic or infectious disease emergence. We need to prevent pandemics, not in the hospital, but at the source, where the virus exists, where the microbe jumps from an animal to a human being. And we know some of these drivers. One, our consumption of wild animals. Southeast Asia is an epicenter of wildlife trade. We know that. Pangolins, wild birds, etc. And then, of course, our forests are receding by the day, also in Southeast Asia, in Indonesia, in Malaysia, in the Philippines, and also, of course, our agricultural systems, because there are so many viruses and bacteria residing in our poultry farms and our cattle ranches and our pig farms. And so, we need to address all these drivers if we want to make sure that this is the last costly pandemic. So as you can see in this study, the cost of preventing the next pandemic is just going to be just roughly around 2% of the entire economic impact of COVID. So this is really, resonating with that adage: prevention is better than cure, and prevention is much less costly than curing a pandemic. The third issue that the center would like to address is the food system. And right now we have a food system that creates this syndemic. And when we say syndemic, it's the interplay of multiple epidemics. The syndemic of undernutrition. 1 billion people on Earth are actually undernourished. They don't have access to healthy and nutritious food. Another 2 billion people are overweight and obese. So some people are actually over-consuming. Imagine, some are under and some are over-consuming. And then you also have that same food system that is emitting a lot of carbon and using a lot of water, soil, and energy and land. And so that's why I said here it's a defective food system. We need to transform our food system if we want to address this syndemic. And that is why there's actually a proposal to shift the global diet to what we now call the planetary health diet. it's nutritious for people, but it's also sustainable for the planet. And as you can see, this is the Planetary Health plate. Half of the plate is greens and vegetables, and only a very small portion is comprised of meat, because meat is a leading emitter of greenhouse gases, but it's also bad for our health. It's a carcinogen or cancer causing, etc. So my question is the Malaysian population or the Southeast Asian population ready for the planetary health diet? And this is going to be challenging because, of course, we love our, I'm trying to recall my favorite Malaysian dishes. The first thing that came to mind is char kway teow, which has some meat and a lot of carbs. Of course, in the Philippines, we're a very much meat loving country, and so we need to have these difficult conversations about the future of food in the region. The fourth issue is, the fifth issue rather, this is the fifth issue, is urbanization. And Asia Pacific is home to the majority of the world's cities that I think have more than 10 million people living in it. Jakarta, Manila, Tokyo, a lot of the major cities of India. And so urbanization is really or Asia rather, is really at the heart of the urbanization story of the world. And we know that unsustainable urbanization destroys the air, the water, and the land, which then in turn affect the health of its inhabitants. So here you will see that some of the major cities in Asia have the highest levels of air pollution, poor air quality, leading to all these estimated deaths. Thankfully, Manila and Kuala Lumpur are not in the list. Okay. So now I'm reaching the last part of my presentation, and these are just some provocations for all of us. We need to flatten the curve of COVID-19. There's no doubt about it. We need to keep on flattening the curve and making sure these future waves do not kill more people. But I think we should also flatten another curve, and that is the curve of our carbon emissions. But the major difference between the COVID curve and the climate curve is that the healthcare system's capacity, you can see the horizontal line there, you can elevate that because you can add more beds, you can recruit more nurses, you can buy more medicines and vaccines. But the Earth's capacity is unchangeable, it's constant, and therefore it's non-negotiable. Remember, there are planetary boundaries. We cannot exceed the boundaries. So the only curve that we can flatten is our curve, our carbon footprint, our ecological footprint. And so one of the thrusts of this center is to educate future planetary health citizens. And it will begin with all of you in this room. And this is a new framework coming from the Planetary Health Alliance. We want our education to be totally revamped. And we want this respect for nature, this acknowledgement of our interconnection within nature to be central in the education of the world's children now and in the decades and centuries to come. We need to change the economy. We can't just be putting out fires and not solving the root problem. And so we need a new economy that safeguards the health of people and planet. It cannot be anymore this kind of economy that tells us to consume more and more, to produce endlessly, as if the planet does not have boundaries, and instead shift towards a donut economy, the one that I described to you a while ago. And lastly, I think planetary health is really about planetary humility. It's the acknowledgement that we are just part of this, great, web of life, this fabric of Mother Earth. And it's a shift from an ego-logical perspective. Oh, we are at the top of the pyramid. We can consume, we can extract, we can kill, we can, eat, we can, and we can do it, without any accountability and without limits. And instead, we need to shift to a truly ecological perspective, holistic, living in harmony with all creatures, great and small, and with the Earth's living systems. So Planetary Health, this is our vision at the Sunway Centre for Planetary Health. We want a safe and just world where the health of humans and the planet live and thrive in harmony, because we owe it not just to ourselves, but to these children. This photo is taken in the Philippines. Children already carried in these containers to protect themselves, to protect them from COVID, but also from the climate crisis and all the planetary health challenges that I described a while ago. We owe it to these children, and we owe it to the children who are yet to come. Thank you very much. Let's all be planetary healers, and we really look forward to hearing your voices. Thanks again.
Thank you so much, Renzo. So let me just share, we've got another poll. And I'm also loving the discussion that we have in the chat box, and actually pretty impressed that we've got a really good diversity in this room. We've got researchers to content creators to Dewan Muda, everything, right? Activists and everything. So with that, actually, let's move on to the next poll. Let's bring back that Mentimeter. Okay, so this is our second question. What do you think we can do about it? Like, how can we align our actions now to the future that we actually want? So
create the donut economy. But how, right? That's a challenge. How?
Eat less meat. Maybe let's give this another minute, and then we can actually use a lot of these prompts for the discussion with Tan Sri Jamila later. Got a lot of good ones. We've got a lot of good ones. Can you see? Okay, I think we're good. Tan Sri, you want to take over?
Thank you, Maisara. Thank you, everyone, and huge thanks to Renzo as well. I hope that Renzo did a Planetary Health 101 in 15 minutes, which is really good. I love what I'm reading now. I'm sorry? Oh, I'm sorry. Yeah, okay. I love what I'm reading on the not only the chat, but also on the Slido. And everything that has been put in there is actually extremely important and relevant. So maybe Renzo, you and I and Oliver as well, we can take a couple of these points I see one grouping is around political awareness, political will, and legal reforms and so forth. So that's all part of, lobbying for policy changes. That's one big element there. The other is really about, I see things on education, relearning, capacity, understanding that. I love the one on intergenerational action, and this is exactly why we wanted to talk to you today, because we need to make sure that at every level of we have this communication, but also awareness, and then how do we take action together. And then there's a lot of personal stuff, right? Our consumption, our zero waste lifestyle, and so forth, and also things around research, which is really important, and collaboration. So Renzo, we have with us today a very enlightened group that I feel we can really work with, and also learn from, and see how we can bring forward some of the ambitions we have at our center. So maybe I'm going to open the floor. If anybody wants to say anything, just raise your hand. Anything that you need clarification on. There was a question on whether planetary health is an extension or elaboration of One Health concept. Maisara is going to put up a slide. Yes, yeah. Just to elaborate that, it will be easier for you to understand. But as I said, we would love to hear from you as well. So if you have something to say, please raise your hand. Maisara? Here we go. So this is a great slide. Renzo normally uses it when he speaks about planetary health, because it's his slide anyway. But it really shows you that the health profession has moved from talking about public health to animal health, One Health, global health, eco health. But planetary health is all encompassing. So even if you look at Sustainable Development Goals, planetary health is also an overarching umbrella towards attainment of the Sustainable Development Goals. So I hope that answers the person who asked the question earlier. Do we have any hands, Maisara? Pardon? No. Nobody's putting up their hands. Okay, so Renzo, do you want to comment on what you've seen on the? Okay, all right, Nina, can we give the floor to you, Nina?
Yeah, thank you so much, Dr. Jamila. I really appreciate the invitation here today. I do have a question to, I believe it's Dr. Renzo, right? Please correct me if I'm wrong. Yeah, so I do have a question in terms of systematic changes, particularly in terms of planetary health. So planetary health is like kind of all over encompassing, right? So in terms of like the IPCC report and everything, so there's a lot of like systematic reforms that we have to do, but what can we do in order to introduce it, for example, beyond personal responsibility?
Thank you, Nina, and that's an important question. And yes, as you kind of touch upon, planetary health will require solutions at all levels, from the more structural, global, institutional, systemic kinds of changes that perhaps something like the Paris Agreement will hopefully change, although we know that even the Paris Agreement itself has lots of problems, and ultimately there are political aspects that need to be tackled head on, but also all the way down to the individual, which you were saying, how about individual responsibility? Yes, there are things that we should, be doing, and that's why I've been seeing in the answers, education. We really cannot expect lasting behavior change to happen if we will not educate not just the young children now, but I think even the adults. And it has to be an intergenerational, learning, relearning, retooling, even dismantling our old, beliefs, and trying to adopt, for instance, planetary health values and principles. Of course, easier said than done, right? But ultimately, that is what needs to happen. And so the Sunway Centre will, try to maximize its resources and also its connections, for instance, with the young people, to accelerate, for example, the raising of awareness and changing of behavior, and ultimately influencing of policy. We want to work with the Malaysian government. And I believe Tan Sri Jamila is already doing a lot of work, for instance, in trying to inject planetary health into the Malaysian government's agenda. At the international level, we're also advocating for that. And for instance, as some of you might know, COP26 is happening in November, and our center is part of this community of organizations that are calling for COP to be a health COP, so that health really is put at the center of the negotiations. By the way, in the Paris Agreement, the word health was only used once, and that is in the preamble. And so you can just see how health has been sidelined in these environmental discussions. But what planetary health is doing is it's putting now health of people and health of the planet at the center together. So I hope I was able to answer your question, Nina, and thanks for your question. I look forward to other people's questions and insights as well. Thanks.
Hello, my name is Aidi Liman from My Hutan. I wish to pose one question. There have been reports that have proven that indigenous peoples protect from all around the world protect 80% of biodiversity. Their food systems are sustainably managed. Is indigenous participation beyond just patrollers of poaching integral, important in terms of preventing biodiversity loss, preventing zoonotic diseases? Is leadership amongst indigenous people, Orang Asli in Malaysia, all around the world, an important factor in preventing biodiversity loss to achieve planetary health? Thank you so much.
Tan Sri Jem, do you want to speak to that on the indigenous and maybe some Malaysian perspectives?
Sure. I think that's a really important question, because beyond the regular, things that we do with indigenous people, I think that a lot of solutions can be derived from the indigenous population. Our biodiversity, for example, for many of the Orang Asli or the indigenous people in Malaysia, they know where to get their medicine, right? And I'm feeling it right now. And I went to Perak to speak to Orang Asli recently. A group of them refused the vaccine. Many a time, they say to me, if you people didn't touch our forests, we would have been able to find our medicine, right? A lot of political and social tensions around where were you when we were worried about our land, and now you're worried about us getting COVID, that kind of thing. So a lot of those things that were mentioned or written in by all of you is so relevant to planetary health, finding that balance. And I think this is precisely what we're trying to do. But just to build on what Renzo also said, why, just to give you a bit of background, Renzo and I met each other in Geneva, and we were both passionate about planetary health, but he's the smart one. He went to do a PhD on it. So we sat at dinner, which I cooked. I made sure I fed him well so that I could have a long time to discuss with him. And that was the only time we have met physically. And it was about 1.5 years ago, no, Renzo? Yeah, and then we both said we need a planetary health center in the region. I work very hard now together with Renzo and Oliver and Maisara and Sunway. We chose Sunway because when we pitched it to Sunway decided that they want to shift their entire university's focus to planetary health, which means that planetary health becomes the basis or the raison d'etre of the universities, whether you're doing engineering or chemistry or arts and humanities or even culinary arts, that there would be Planetary Health would be the center of that. And I think that's fantastic. If this pulls through, then it's the first university in the world that actually centers its education around planetary health. And this is precisely what we need, a complete shift in how we look at education and learning. So I'm going to stop there because I know Chiang and Aidil wants to speak. So I'm going to hand over to Chiang first and then Aidil. And then Sanjay.
Right. Okay, right. Thank you, Tan Sri. Thank you for the invite as well. Dr. Renzo and Tan Sri, want to thank you guys again for setting this up because we have had a session earlier in April this year. And it's just really nice to see there's a continuation of work and eventually come to this progress. So I managed to run a quick survey among my medical students in Malaysia. We have data from 50 medical schools, almost half of the number of medical schools in Malaysia, which is close to 30. 60% of them reported that they were not introduced to climate change and health at all. 15% was by faculty activity, which is good. We want the 15%. And the remaining 35% is by student-led activity. But there's a lot of work that we can do here. We can try to incorporate the content into the medical curriculum. We also need to get the buy-in from the faculty staff, and it will be difficult for us to do as merely a student organization. But now with the center being set up, I believe we can try to work on that. On the more hopeful side, it's that 90% of respondents say that they believe that this actually will affect their future patients' health. And 80% of them believe that healthcare professional has a role in this and they want this to be taught in the medical schools. So I hope that we can continue the discussion and work on this in the future. Tan Sri and Dr. Renzo, thank you so much.
Thank you. We're going to take all three and then we move here. So Aidil and then Sanjay.
I believe I already posed my question regarding indigenous people participation in conservation. Yep.
Tan Sri, you're muted.
I see a lot of hands now. Sanjay,
Right. So,
Daniel, and then Sufyan, yeah?
Yep.
Hi, good evening, everyone. Good evening, Tan Sri, and good evening, Doctor. I have two questions very quickly. So the first question is Planetary Health also looking into exploring the various risks from bioterrorism, and specifically the possibility of hackers or individuals with the know-how tweaking certain zoonotic diseases to make them a lot more infectious and a lot more deadly at the same time? That's one. And two, how do we transform our political structures in a way that is not just more receptive of or inclusive of leaders who are more competent in dealing with pandemics, but also making sure that the government is accountable to its people, letting its people know specifically if there is an infectious disease outbreak, because like what we have seen in not just in COVID-19, but even in the past before, government secrecy and a lack of accountability and transparency has resulted in diseases percolating in a certain locality and ultimately spiraling out of control. So those are my questions. Thank you.
The next person I said was Sufyan and then Daniel, is it? Daniel and Sufyan, okay.
Thank you, everyone. So I have a question about planetary health innovation. So I'm just wondering whether Sunway Centre of Planetary Health is going to spearhead, the Centre of Excellence for Innovation that focusing on the planetary health outcomes. When we have like a lot of young people here, I'm pretty sure young people are very geared towards innovation and we always wanted to invent something new. So rather than discussing ideas, I think let's discuss on a framework, on a program that we can work together. And then the second one, as Dr. Renzo mentioned just now, on food system redefinition, is there any focus in Sunway Centre of Planetary Health for food system and also health system? So, and the last question would be, when we single out planetary health as a center, are we like not paying attention to the medical school. I just feel like Center of Planetary Health should be housed in the medical school so that we can influence medical education, so that we can train our doctors to become our agent of influence, since doctors reserve like such a high regard in the community. So probably that's one of a few things I wanted to ask. Thank you. Back to you.
Thank you very much. Then we have Sufyan and then Timothy.
Hi, I wouldn't say it's a question, but more like a comment. I think I mean I've been reading on planetary health, and I found that a lot of confusion arises because people are still trying to understand what comprises of what makes up planetary health. You know, even things like global health, One Health. There are still a lot of confusions into what those areas actually are. And planetary health being a new, at the forefront, comprising everything, it's a wonderful and very important concept and cause. But I do think that there is a need to really change the mentality and make people understand what planetary health is. Because I mean, from my work, so I do a lot of work with those involved in the disaster DRR area. And even them, they are quite protective of what constitutes DRR, and a lot of the time heat waves are not mentioned in DRR, and health, etc., is also not mentioned in DRR. Talking about planetary health, it's good, but I do think that there's still a lot of barriers that needs to be broken, especially amongst scientists who are already in the field, who think that they should work in silos. Stay within their field, and not talk about other working and collaborating with other disciplines. And I think so is this something that the Planetary Centre in Sunway is planning to do, because it is very important to break down those barriers and really promote a multidisciplinary and transdisciplinary discussion for planetary health.
Thank you, Timothy.
Thank you for giving me the opportunity. This is really a question to build up on what Tan Sri has discussed just now regarding the indigenous people, and I guess it's directed to all medical students and medical staff in this call. I do notice from my limited exposure to the medical world that there are a lot of single-use items. For example, Clinell wipes, you have sanitary absorption pads that clean up soil bedding, and a lot of these things are use and throw, and it's not just limited to those. It's also applies to a lot of non-recyclable things like plastics and rubbers for eye gels, OPA airways, things like that. And from what Tan Sri was telling just now about how the indigenous people could find their own medicine and we could learn a few things from them, this kind of makes me wonder, if we were to make a big step away from single-use plastics, from having to use such resource-intensive methods, in order to preserve planetary health, are we required to regress to a previous stage and develop from there? Basically, it's like you play a game, you've made some bad decisions, and the only logical step is to go back to the last save point and then continue on with a different path? Or is our goal right now to just make do with what we have and change our course from where we are?
Great. So all really very, very good comments and questions. We'll try and take them up. There was a question about, accountability. How do we make sure that, the next pandemic, countries or whoever is held accountable? So there's some work being done on this. I happen to be on a global public health convention council, where we are looking at pushing for a pandemic treaty. If you have read there has been the independent body on the pandemic monitoring recently, and what it came up with was, the whole recommendations around, the preparedness, the partnerships, the frameworks that need to have been developed, but it stopped short of calling for a treaty. And unfortunately, in the World Health Assembly this year, this did not materialize. People were afraid to move past the treaty line, right? The discussions on the treaty. So a group of us, led by Dame Barbara Stocking, who used to be one of the leads in the Ebola crisis. So we go back a long way. So she has invited me on this Global Public Health Convention, and we are really going to try and bring together a wide range of stakeholders to push for a pandemic treaty so that we can hold nations and states accountable. Now, this is going to be a very tricky journey, I am quite certain, but we do want to try. But before we even get there, we need to get more and more people on board to understand and buy in. Of course, politics is very important. It's about, how do we have political will and the leadership that actually embraces this change that we now need to go through in a very rapidly changing world. But it's up to, this is why this conversation is being held. We believe firmly that it is an intergenerational issue. When you look at, for example, the whole issue around climate, yes, everyone has been talking about it, Paris Agreement, Kyoto protocols and whatever, but it took, a young Swedish girl to take people onto the streets and out of schools for, a lot of the Western leaders to take notice, right? And for the first time now, we have the IPCC report that's calling for code red for humanity, but still, we want to see the commitments from states to do that. So we have to start somewhere. Let's put it this way. I think I want to see that the pandemic could be this opportunity for us to raise much more awareness to our public, but also our politicians and our leaders that planetary health is essential, that we need to look at, our planetary boundaries. We need to look at climate. We need to look at how we make much more sustainable investments. How do we have a mobility policy that reduces our carbon emissions? How do we have better public transport? I must say there are some enlightened leaders in our bureaucracies, in our ministries. I certainly have been working very closely with the Ministry of Environment and Water, CASA, and they're already way ahead, already designing a planetary health framework, looking at, all these things and bringing some of the discussions to COP26, setting up the Climate Action Council in Malaysia, which I'm a part of now. But I still think the gap in the Climate Action Council is actually bringing a young person as an expert as well as civil society. So I think, I will work hard to see whether we can be more inclusive in that. But we just have to start somewhere. And I think, this is the beginning of a conversation. I'm going to touch next on on the innovations. I'm a big fan of innovation, but I think if you ask me, right, product innovation is the easiest thing to do. And we know it now from COVID-19, if business people had the foresight to make biodegradable PPEs, all the things that we need, right? I mean, you probably aren't aware of this, but our vaccine program is the first vaccine program, which is a green vaccine program, which means that we will be calculating our carbon footprint from the vaccine program and offsetting emissions from it. And this is something that is because, the CITF, where I'm a part of, work with, again, CASA and the Ministry of Energy to look at, how do we, at the end of this, look at making sure that we are a carbon neutral vaccine program. So all these things were thought about because, there were a few people like me and Dr. Shizaini who pushed hard to say, let's make this a different vaccine program. So I think it's, not many people know this, but these are the aspirations as well of the vaccine program. Now, also on innovation, I think the most important innovation, as you know, with innovations, is process and paradigm innovation. It's really about how do you change your processes, your mindsets, rather than just produce a product, right? So these are the most difficult innovations. So I think Sunway has a maker lab there. They have quite a sophisticated bunch of people looking at, for example, technology and innovation, vaccines, all sorts of stuff with virology. And so I think that, it will be something that they will embrace. I'm going to just briefly touch about food systems, because I think at Sunway, for example, they have a culinary school, as I mentioned. They also have an urban X, when they're looking at sustainable farming and so we will be able to work. So the purpose of the center is to work with all the different parts of Sunway and external partners, so that we can then demonstrate that planetary health is not something that's super science and rocket science. It's really about common sense. It's really about bringing different parts together and working together. But leadership, good governance, and all that is important for planetary health to thrive. I'm going to pass to Renzo to give him time, but since I know more about the health policies, the disaster policies, you're right. I think it was Timothy who said about DRR, right, which has very little mention around health and heat waves and so forth. Now, this COVID and the climate impact now has really changed that. People are now beginning to talk about, for example, in ASEAN, I hope Oliver will share as well, that in ASEAN, they're already looking at, for example, disasters and pandemics, right? Whether it's a disaster arising from a natural hazard or a pandemic, your disaster management systems must function with a multi-hazard approach. And leadership has to have a certain quality. Systems need to be in place. Data, analysis, use of artificial intelligence, all this is required now in this day and age for us to be able to do better. Same with the management of the pandemic. You needed artificial intelligence. You need automated tracing. All this was not in place. So I think that, we have a lot to do. You may have seen, I produced together with the team, Greater Klang Valley Playbook, and it sort of, laid out 10 things that need to shift, right? And how we can design playbooks together so that it's a live document, a learning document. And I would love Renzo and Oli to come in on some of the other questions as well. So over to you first, Renzo, and then Oli.
Yeah, well, actually, Tan Sri, you already covered all the questions, so that's great. And I just want to, highlight one comment about, are we going to work on issues like bioterrorism or even, issues related to misinformation? I didn't include them in the slides, and they're not necessarily our main themes. But at the end of the day, all of these issues are interconnected. And so it will not be, it will be inevitable for the center to be looking into, these issues and how they intersect with, for instance, pandemic prevention. We said we want to make sure this is the last pandemic of its kind. And part of it is really looking at not just the more natural kind of, outbreaks, but also the possibility of human-made ones. And so, hopefully eventually we'll get to, those arenas. And yes, I just want to reinforce and to support Tan Sri's comments about, innovation, about the importance of political awareness. A while ago, there's a question about, are we going to adopt a top-down or bottom-up approach? I think it's both. Both are very important. We will deal with the policymakers at national and global levels, but we will work with the farmers, the indigenous communities, in finding solutions at the level of the community. We're very excited to be working with the Sunway's faculty and students. We're now discussing about how can we engage the students of Sunway University, regardless of the discipline, regardless of the course, to be able to contribute to planetary health solutions and innovation. I'll stop there. Maybe Oli has some stuff to add.
Very little, because I think you two have covered it very well, and I'm not at my best at all today. I have no voice for reasons which you guys know about. So I'm not going to add a great deal. But Jamila, just on ASEAN and the kind of regional perspective, yes, there is now, if for those of you that subscribe to a magazine called The ASEAN, the latest edition is all about the intersection of disasters and health, and it's worth reading. Now, one of the things, I've worked quite a lot of my life now in this region and quite a lot of my time with ASEAN, but one of the things that strikes me is the relationship between ASEAN and the people of ASEAN is not sufficiently close. You have a lot of policy discussions going on in the hallowed portals of the ASEAN Secretariat in Jakarta. And actually connecting that with the reality of what people are experiencing, I think is something that we can work on. And that a lot of that is going to be around the communications piece that I'll be helping the center on. And the other thing is, we're sitting here and we're having a nice conversation. And Renzo, that was a brilliant presentation. And thank you. I feel more educated now than I did an hour and a half ago. So thank you for that. And I've been around for a while. But it was a really useful presentation. But, we've got, I don't know how many billion people out there just in the Indo-Pacific region. How many of those people know, understand, are interested in planetary health, or would be interested in planetary health if we can get the word out to them? So I think, devising ways and means, particularly amongst young people, to get the word out around what planetary health is, that it is a different way of looking at the challenges and opportunities that we face in the future, I think is going to be really important. And your advice and help, because I'm an oldie, I admit to being rather ancient and not very much in touch with modern communications means, which is why it's great to have Maysara and Khadija on the team. But how do we get the word out? How can we work together on that? This is what I'm interested in, and I think what we're all interested in. So more to be said on that. And I think just to kind of to bring that round, if I may, Tan Sri, just to say, one of the objectives of having this meeting was to kind of figure out what might we be able to do in future. This isn't just a one-off meeting, that this hopefully is the start of something. So I will drop that penny there and hand it back to you, Tan Sri, to kind of to maybe take that bit forward. Thank you.
This is great. I think the first thing I would say, obviously, this is the first time we're meeting. So, and thanks for your time. Based on this conversation, we would love to hear how you might want to be involved in supporting us. We have some ideas that you're going to share, Maysara? No, we have some ideas that we've cooked up, but we wanted to really be consultative and not, sort of say this is how you do it, right? The last thing I want as a young person is for someone to tell me how I should be doing things. But so it's really great that you're giving us a lot of input here. What I would love we would love to have is, Maysara will drop, Khadi will drop her email into the chat box. And you can reach out to both of them and and maybe mention in which areas you're excited about, you want to be remaining in touch with us with, and just to manage everyone's expectations, the Center for Planetary Health is only 27 days old, so it's not established as yet, and with COVID it will take us a bit of time to hit the ground running, but we are very excited because we have lots of ideas on the launch, lots of activities we want to do. It's going to be an MPU in the university, so students are going to have been doing projects on planetary health. I will be talking to the Sarawak government, or they are setting up the Center for Infectious Diseases in Sarawak. So we're going to see how we're going to collaborate with them. We really want to collaborate like hell, right? And really see how we leverage. Planetary health is really about building this amazing network of people who will take forward things. It's not a prescriptive, like, only the center will do it. No, we want to influence. So we'd love to stay in touch with you, but all the things you mentioned from the start, politics, governance, good policies, really what Kira and others are doing to bring young people into decision-making positions, I think is crucial for us. And this is why we chose to base ourselves in the university, so that we'll be inspired by young people continually, and also, challenged by all of you as well. When I started, when I took on this position, my KPI I set for myself is that within 5 years, I need to be replaced by a younger person. And I'm very determined to do this. So, those of you who have ambitions to be the executive director and professor of planetary health at Sunway, start working and to displace me, please, because it's really important to get young people leading this. And then Maysara has one thing that Ollie is not feeling so well, so he shouldn't speak so much. But one of the things that Ollie is going to help us with is, Oliver is going to help us with, is to demystify planetary health. You know how science and medical stuff, and we don't think it should sit in a medical school because planetary health is bigger than a medical school. What we need to do is to make it, understood easily by everyone. Not try to sound too clever, because if you're clever, then people will understand everything you say. So the best way to do it is to keep it really simple. We want to game it, we want to animate it, we want to do all sorts of things. We're planning, but when we actually launch, it's got to be a film that we've got to deal with to screen for the public. So I think this is just the beginning of our journey, and it really is going to be a journey. We're building it as we go along. As I mentioned, there are very, very, very few planetary health centers around the world. It's not even a pure planetary health center in many of the centers around the world, but we are going to try. Okay, so my Sarah is going to put up another question on Mentimeter. Please bear with us, but we would love for you to tell us next, how do you feel now? Yeah, about the session, and and also please give us feedback as well that you want us to have. And I think Sarah and Kadi have put their email addresses already, and Oliver too. Oliver wants to hear from you, your comms person. I must tell you, I'm smiling away, and I'm sure Renzo and Ollie, and I know Sarah and Kadia are giggling with me here. When Sarah did a trial run with us, she put, in how do you feel, she put hopeless. And I said to her, oh God, I hope no one puts hopeless in this session. So I'm very excited that you put a very hopeful and inspired and excited, because we are also inspired and excited. So I think, we really have, I just feel right now, to be honest, very supported, and feeling that, it was the right decision to set up the center. I think we will need your energy, your advice on how we actually get, can we have the next, planetary health Greta Thunberg, out there on the streets with us to really raise awareness on planetary health. But I think this is really amazing. So, it's great. I am glad that the word inspired has come out very prominently. I'm also very happy to see that people are excited. They feel that it's hopeful, and they're curious, and they feel educated. So that's much thanks to Renzo as well. But I think we will stay in touch. But our Twitter handle will be up soon, where we will start to upload stuff. But the plan is that by October, we'll get things, really running. We're building our website. It's a beautiful website, by the way, which Sarah had a great deal of work put into. And in the website, we were planning that we will build a circle of, what is it called? An online community of practice, or online community of supporters. And we want to also on the website have an opportunity for you to get your organizations featured on our website, so that we will link and partner with as many organizations as possible. So, Sarah, have I missed anything out? Nope. So it leaves me to thank all of you, and I hope that I'm usually very punctual. So it's 4:52. We have 8 minutes. So yeah, can we get a group photo with everyone? I'm being advised by Sarah, we need to do that. So, so if everyone can turn their cameras on. Yeah. So fix your hair, put on your lipstick if you want, yeah, you tell us when. I'm going to turn off my thingy now, Sarah, and you tell them when to smile or whatever.
Yep, just turn on your videos and then even Kadi doesn't have her own video turned on.
Yeah.
Yeah.
So by accident, all of us are wearing black and white today. Kadi, myself, my Sarah, even my husband is in black and white.
Not even twinning anymore.
Yeah.
Double twinning. Okay, I think we've got a good number. All right. 1, 2, 3. Another one. 1, 2, 3. Okay, all good. Thank you so much. Thank you, everyone.
Thanks, my Sarah. Thank you.
Okay, so we are keeping time. Renzo has put in a couple of links. You know, he has been a prolific speaker, by the way. Everyone knows Renzo. I think he's one of the most prominent planetary health scientists in the world. We're so fortunate to have him as our chief planetary health scientist. And a young, youthful chief planetary health scientist as well. So I'm very excited about this. This will not be the last time you hear of me talk and reaching out to all of you as well. So hope that, you know, with time, we'll maybe have an online community that we can communicate with and work with as well. So with that, you know, just to say thank you and bye, everyone. Stay safe and have a good weekend.
Thank you. Have a great weekend. Bye-bye.
Take care, everyone.
Okay.
Bye.
Everyone.
Great.